Hey there, Todd Cameron here, GP and co-founder at M3 Health. I just thought this would be a useful opportunity to give you an update on where M3 are at and what we're seeing with COVID in the community at the moment, and to give that some context for you. So we have seen a lot more outbreaks in hotel quarantine workers infected with COVID, and the reason for that is that in a global sense, COVID is still a raging fire, and whilst Australia has done really well, the numbers globally are higher, and there are a few more of these mutant strains, or to use the terminology from the Chief Health Officer, variants of concern. Either way, we expect viruses to mutate. That's what they do. And if we use the flu virus for an example, every year there are 4 different strains of the flu that go into that single vaccine. And it changes every year, typically depending on what's been popular in the Northern Hemisphere winter prior to our winter. So we should expect that viruses mutate, and the larger the number of the virus, the more opportunities for it to mutate, and it's running pretty wild in many parts of the world, and we can feel quite distanced from that in Australia, of course. So a couple of things to keep in mind. The first thing is that at M3, you'll notice when you go and see your GP at the clinic that we're back to consulting from our regular rooms. So the doctors will be running telehealth sessions where they work out of usually their room, occasionally from home. But then when they're seeing patients, they're seeing them in the room. Now, we are treating every patient as if they are COVID positive. That is a sensible thing to do to make sure that you remain safe and the workplace is safe for everybody here. So that means that you do need to wear a mask at all times during a consult. Perversely, as the community transmission levels are low, the most likely place for COVID to show up is in a GP clinic, not in a hospital, because that doesn't happen for generally 14 to 20 days after infection. They're more likely to come in early. Please do not come in with respiratory symptoms. That still needs to be taken to a respiratory clinic. If it turns out that you did have COVID, you would be putting your fellow patients in the waiting room, the other community members, the GP, and anybody else that you come across on the way in jeopardy. And what I mean by in jeopardy, even if they get the cold symptoms and it isn't COVID, they still need to take at least 2 days off work, go and get a COVID swab, and then wait and quarantine until they get their results. And even then, if they're unwell, you can imagine if you went to see a GP and they had a respiratory infection, that you would be somewhat anxious about seeing them. So please, please, please do not present to the clinic with respiratory infections. I know you often think, don't worry, this is a cold. I know it. Trust us, COVID can look like anything. And when it pops up in the community, as we said, it is most likely to show up in general practice. So please make that a telehealth consult, have a conversation with your GP, and then we'll determine the best course of action for you at that time. The other thing to say is we have submitted expressions of interest for the 1B phase of COVID vaccination. At this point in time, that looks like it's going to be AstraZeneca Oxford vaccine. That has not yet received TGA approval, but it is a vaccine based on very, very similar processes to a large majority of vaccines out there in the community now that we're using. And so we're excited about the prospect of contributing to immunising all of Australia, because that is our way out of this. And don't let the fact that we don't have much COVID fool you. There is a lot that is holding it back. And so if we're going to get any sense of normality at the end of this pandemic, vaccination, immunisation is going to be the way that we do it. So I hope that's been useful, giving you some updates as to where we're at, and I look forward to any feedback in the chat below this. Bye.